to Share. I am Joe Steinfield, and I'm very pleased to introduce today's moderator, Sean Driscoll.
Oh, thank you. Welcome. My name is Sean Driscoll. I'm a member of the board of directors here at the Jaffrey Civic Center, and I'll be the moderator tonight. The mission of the Jaffrey Civic Center, where you now sit, is to provide and sustain a public venue where people from the Monadnock region can pursue artistic, educational, and civic activities. And so you coming out tonight, you braving the cold weather and being here physically, help us fulfill our mission, and for that we thank you. How many of you are, thank you. How many of you are here for the first time? This is the first time at the Civic Center. See, that's wonderful, and we hope that you'll come back and visit us for other things. This is Stories to Share. It's the brainchild of Joe Steinfeld, and this is our fourth season. This is the fourth talk in the fourth season, and we'll continue to have these talks on the first Friday of each month until June. We wouldn't be able to do these talks without our sponsors, Savings Bank of Walpole, Bell Tates, and the Monadnock Ledger Transcript. So we're very appreciative of their support. But we also rely on the support of friends of the Jaffrey Civic Center. So when you're giving money to your favorite nonprofits, please keep us in mind. What we'll do tonight is that we will have the talk, and then if there's time allowing, we will have questions from the audience. But at the conclusion of the event, there will be a reception in the conference room, graciously provided by Nancy Bell-Tate and Jean Duval. And so that's another chance to maybe ask some more questions of Dr. DeVinne or talk with other people about what you heard. The talk is being recorded by our new audiovisual person, Megan Raymond, and it will be uploaded to our website and available in about a week or so. So that you can rewatch it, but also there are a lot of people who weren't able to make it in tonight, unfortunately, and please spread the word that they can watch the talk next week. Dr. DeVinne is going to talk about veterinary cases, and he assures me that there's nothing traumatizing in the pictures he's about to show. But you know that the threshold that medical people have and the threshold that we have, that people like you and me have, might be somewhat different. So if you feel free to close your eyes or excuse yourself, and we will not be judgmental, I promise. Dr. DeVinne earned his DVM from the New York College of Veterinary Medicine at Cornell University. He practiced in Vermont for a while and then soon moved to the Monadnock region. In 1989, he opened the Animal Care Clinic, where he still practices, on Concord Street in Peterborough. He is a legendary veterinarian for our area, those of you who know him. But his contributions to animal welfare go far beyond his practice. I teach in the Conval school system, and I know that all of our policies and procedures about how to handle animals or have them in the classroom or not have them in the classroom, many of those were informed, if not written, by Dr. DeVinne. And he also has had an internship program at his clinic for Conval high school students for a number of years, and in the past he taught a class on the introduction to veterinary medicine for middle schoolers. He also is the author of The Orvis Guide to First Aid for Sporting Dogs. And these are the little tidbits about him that even if you know him, you might not know, that he's a championship level shooter in the area of sporting clays, and he makes and repairs banjos. So please give a warm Jaffrey Civic Center welcome to Dr. Charles DeVinne.
Thanks, Sean. I really appreciate it. So are we doing pretty well with this mic? Is this working for you guys?
I think you got to talk into that one a little bit.
All right. Is this
Yeah.
working? Okay.
Yeah.
Terrific. All right, well, a little bit of background. I guess we should get some photos up here to get started. Am I okay to get going with something? Pardon me?
Yeah, you got it. Yeah.
Okay.
Stay closer to that mic. I'm maybe moving over. There we go.
Yeah. All right, how's that? Is that better?
There we go.
I'm almost gargling with it now.
There you go. It worked great in rehearsal.
Yeah. I missed it. Okay. Well, let me start this off. I think the best way for me to start is to tell you how did I get involved with veterinary medicine. Nobody in my family had anything to do with medicine at all. We had pets growing up. We had a veterinarian and things. So it actually starts when I was a little kid, 4 or 5 years old or so. I had a tremendous interest in mechanical things and how they work. And so I took them apart. You know, refrigerators, toasters, wall sockets, things like that. And unfortunately, as time went along, and now I'm up to, say, getting close to junior high, many of the mechanical gifts that I'd received were investigated and never went back together again. And so a common thing that my father would say to me is, Chuck, can't you put that back together again? And of course the answer was no in most cases. So where's this going, obviously? So now we get to junior high. And our English setter runs off and finds himself in a battle with a raccoon. And gets really basically facially disassembled. Okay? And he was a mess. He couldn't even drink water. And so we took him down to the vet, and I went with my dad, and we were thinking, oh, this might be the end. He put him back together again. And that was it. And I said, I'm going to do that. That's going to be my career. And so that's when it started, and I didn't waver. It was a big moment for me, a huge moment. So as we go along, I spent some time in high school, you know, observing and all that kind of stuff, and worked at a dairy farm summers, and basically got my feet wet and went on to college and kept it in my mind this is where I was going to end up, and managed to do well in undergraduate school and got myself into veterinary school, and there you have it. That's how the whole thing worked. And interestingly enough, to this day, I look forward to going into work each day that I'm to work, so it hasn't worn off yet. So now you know my backstory. All right, let's see some pictures. All right, so this is me up in Vermont. This is a cow who's actually down with milk fever. For those of you who don't know, milk fever it has nothing to do with an infection. They're low on calcium. You'd know it as eclampsia in people. And she's getting an IV, putting a catheter in her jugular right there, and we're going to get her back on her feet shortly. Farm hands using a nose lead to turn her neck so I can get a good shot at her. So that was pretty typically my life when I was up in Vermont. Mostly large animal work, occasionally a dog or a cat. So we're supposed to tell stories. So I've got to tell you one story that happened to me. So that year I was in Vermont, we had very low temperatures, about 2 weeks of well below zero, close to 30 below. And I was in one barn, and we had a cow that was down with milk fever like this, and she is having trouble delivering a calf. And so I had to lay down on my side next to her. She was in a stanchion, and I'm sort of near the gutter, and I'm working on her, rearranging this calf to get it out. And I am able to finally get it out. Better to the mic? Sorry. Okay. So I am able to get this calf out. And all's well and good until I try to get up. I'm frozen to the floor. So farmer comes over with a bucket of hot water and thaws me off. It would be humorous, except I lost a good jackknife in the gutter and I never could find it again. So, anyways, that was one of the interesting things that happened in Vermont. And one other little story we had in Vermont. We had a cow, it was a beef cow, who got into a porcupine and got a face full of quills, and we thought, gee, we really ought to get those quills out. So we played cowboy. We were able to get a lasso on her. We got some drugs into her. We got her slowed down, and we tied her up the only place that we could to a beam in this barn. And she wasn't asleep as much as we thought. And so when we went to pull the first quill, she yanked the beam down, and the barn came down about 4 feet or so, and we decided we could leave the quills in that barn. And so that was the end of that. Okay. I have done a little bit of large animal work here when I was in New Hampshire. A couple pictures, some sheep that I worked on here. I'm doing a health certificate on this sheep, just checking it out before it goes off to a fair. Getting in the back of a trailer, same thing, doing some health checks. Back. I had a couple of mules that came over to the office to, visit with me, and they're there for health checks as well. So I'll switch over to small animals a little bit. Okay. So this is a radiograph of a cat. My daughter actually corrected her second grade teacher one time when we were talking about these images. So as I had back, and these are all digital, but back then we had film. And so I put some film up on the viewer, and her teacher said, oh boy, we're going to look at some x-rays. My daughter, who's in second grade, goes, you can't see x-rays. X-rays are invisible. Those are radiographs, right, Daddy? So this is a radiograph of a cat, okay? All right, let's see if my pointer works here. Oh, how about that? So this is the cat's stomach right here. This is a microchip, for identification. So you can see there's some interesting looking stuff in here. And what it turns out to be, most of you have cats would probably know what they like to eat. Let's see if it goes, whoops, back to this one. There we go. Hair scrunchies, okay? So now this is about as yucky as it gets. There's a couple that are sort of like this. I promise not to do a lot of blood.
He promised.
Okay, there won't be much blood. Okay, so yeah, I'm heavy on the button. So we're looking, let's see if I'm on the right one here. I'm supposed to point at this, aren't I? There we go. Okay, so you're looking at a pug who is having surgery. And the reason he's having surgery is this isn't much of a nostril. And so we're going to make a new one for him. Okay? And a lot of these short-faced dogs really have a problem with breathing, either something with their palate or something with their nasal passageways. And so this guy really needs some help, because when the weather's hot, you really can't get that air through the nose very well. So there's one side done. And just shows him being, he's got his endotracheal tube in, so he's on his inhalation anesthesia there, and over here is his pulse ox and things, keeping track of them. So, and oops, back. There he is, his new noses. So they're actually, it's a little dark, but they're about this big now. So I'm pretty happy about that. So next one's a little Yorkshire Terrier, comes in as pregnant, and we want to see how well the pregnancy is going to go. Not well. That puppy takes up probably 30% of the dog's abdomen, so there's really no chance that we're going to deliver that normally. So cesarean section, and there we are afterwards. See, I spared you the details on that. There'll be another one, but all right. So, and interestingly enough, so this picture with this mother and this puppy is about 40 minutes after I put the last stitch in.
Wow.
So that's how quick the recovery is on this, and they're back and they're nursing within the hour. Okay, so yeah, they're pretty fast. All right, and this is an owl, obviously. We do some work with a rehab center that's actually over in Temple, and periodically he'll come up with something that has been injured and would like us to take a radiograph X-ray image and make sure there's no broken bones and things. So we did, and there was no broken bones. It was just kind of a fun picture to look at, just kind of see what avian bones look like. They're very light. There's very little cortex to them, very little thickness. I think there's a couple more bird pictures here. Here's a hawk that came in for the same reason. This person's a rehab person, and this is one of my staff, and came into, this one got an x-ray as well too, just to see if there was a broken bone to determine whether we need to do more treatment or not. And this one, this is Mr. Clucky. Mr. Clucky is a famous rooster. Mr. Clucky is an icon for the owner's mission to basically campaign for animals in low-cost government-supported housing. And Mr. Clucky's been to Washington, and he's been all over. He's summer in Dublin. Mr. Clucky was here today because his comb wasn't very red. Okay? All right. Well, that's not like, oh, gee, his comb's not red. Well, actually, that's an indication that he was anemic. And he was anemic because he had parasites, which we sorted out. So, but you could probably look him up on Google. He's a pretty famous bird. So, all right. This cat's having a great day. So cats get into porcupine quills too. Okay. He's asking for sedation. Okay. All right. All right. So's this guy. So we have a story to talk about porcupine quills. So it's in the spring, and it's back before we had emergency clinics and all that. So this is a long time ago. And one of my clients, both his Springer Spaniels got into quills a little more excessively than this. The face, the chest, the shoulders, the whole thing. And so he showed up at the office towards the end of the day, and I said, look, we'll finish up with the appointments, and if you'll help me, I'll knock both your dogs out, and we'll get all these quills pulled out. Back then, the anesthetic that we had, we could not reverse. And so once we knocked them out, they're going to stay knocked out for hours. Nowadays, we can turn it on and turn it off quickly. So we knocked both dogs out. We spent probably 2 hours taking quills out. There was just hundreds of them in each dog. And so we finished up, and they're sound asleep. And I said, so how about I just hospitalize them here for tonight? And he said, oh, no, I'll just take them home. Well, I said, you sure? He says, yeah, I'll watch over them. He said, so we put them both in a big very kennel that he had, one of these big plastic kennels, and locked them up, and I helped him carry it out to his truck. And when he got home, he got the dogs were still asleep, so he pulled the crate into his kitchen, left the door shut, and that was it until the next morning. And he called me about 6 o'clock and said, hey, were we asleep last night? And I said, no, we weren't. We were pulling quills. And he says, well, he says, I walked into the kitchen this morning, and I opened the door to the crate, and I let the dogs out, and they're full of quills.
Inside the crate.
Door was shut all night. Perfectly clean crate when we put them in.
The porcupine's in the crate.
Well, yes, in the dog's stomachs. And of course vomited the quills back up and got right back into them again, and we started all over again. So there's an antidote for swallowed quills, by the way. So anything sharp that a dog swallows that we're just kind of hoping will go on its merry way, Wonder Bread. Fabulous stuff. Fabulous stuff. Everything sticks to it like glue. Hearing aids, bobby pins, needles, pretty cool stuff. It's a really amazing antidote. It's got to be the cheap stuff, though. It's got to be Wonder Bread. You don't want to use any of this whole wheat, all natural stuff. No, white squishy stuff. Anyways. All right, let's see what's next. Okay, so now this is the beginning of a C-section. So I'm not going to show you too much. So this one's being anesthetized, and this one's had a very light amount of pre-anesthetic, and we're passing some isoflurane, similar anesthesia that they use at the hospital for us. Just showing you what things look like now. They're on an operating table. We're getting ready to do our thing, and I didn't show you anything.
Hey.
We're all done. That's the incision that's all sewed up. Okay. Just to give you an idea what kind of how these things work. Okay. Yes. Yeah. It is. So, it's a chicken, right? Okay, all right, so, and it's on the surgery table. Okay, all right. So this massive swelling here is we're egg bound. And by egg bound, if you're not familiar with that, it's when the shell gland fails to operate properly and we're not making individual eggs and the abdomen just starts to fill up with a whole bunch of yolk. So it ends up being like a big pile of scrambled eggs. Okay, I'm describing that to you because you're going to see it. A big pile of scrambled eggs, okay? All right, don't freak out. Okay, all right. So here we are during the surgery. Dr. Surdam's there with me. And we're working away. Some of it's out now. It's a lot of scrambled eggs, okay? And so what you're seeing up here is basically she's opened up, her uterus is down in this area here. So this was actually a double. I'll have to see how far I am here. Yeah, now you can see her sewed up. This was the second time. The first time we went in and cleaned out all this impacted yolk, sewed her up, she recovered great, she went home, she impacted again. So we figured, okay, well, about the only thing we could think to do would be to spay her, do an ovariohysterectomy. So I actually called down to Cornell and I talked with the head of the avian department, who was one of my professors, and I said, so what's the process on spaying a chicken? And he let That's exactly what he did. So we were determined to take this on, and so we did. And so it's a little interesting with chickens, though, because there's only one opening back there, okay? Yeah. And that opening serves everything. So we have to kind of figure out which part's the reproductive part and which part's the digestive part, you know, because they kind of come together. So we were able to, during the surgery, able to pass a tube up and watch the tube go towards the digestive part. So I said, okay, that part's good. We leave that alone, and we'll take out all this other stuff. So basically we got up in underneath and was able to remove the ovaries and get the uterus out. And, you know, this went like we wanted it to. There we are in recovery, okay, you know, nice warming blanket and everything. And this is probably half an hour or so afterwards.
Wow.
Yeah. I like this breed of chicken, by the way. I had barred rocks myself for a while. So anyways, we're really happy to work on this. It was really an honor to get a chance to do something that was way outside what we've done. So I actually took a video of the entire surgery and put it on a DVD, and I showed it to somebody who was lecturing, one of my colleagues lecturing on backyard chickens, and I said, so you ever spayed one? He goes, no, and I said, you want to see what it looks like? And he said, so we went over that at one of our meetings. It was a lot of fun. Okay, so here's a dog with a broken leg. It's a tibia, it's between the knee and the ankle, okay, broken right in half there. So this is a farm dog, and so we're thinking, well, we're not going to orthopedics, we're not going to put a plate or screws in. I should tell you a timeline on this. So this isn't all that long ago. This is like maybe 10 years or so ago. So it wasn't like way back. We had lots of specialists at this point in time. But no, we weren't going to do that. So let's get back here. So we went ahead and we put a splint on. You can see this is an aluminum contraction that's around there, and there's a lot of tape involved, but you can see we've got the fracture pretty well opposed. All it really needs is 50% and it will heal. But this picture is bad. There's something bad going on here. And the bad thing that's going on here is the cortex of the bone, which is the solid part, it's like disappearing here. And this is getting dark and fuzzy. And that's osteogenic sarcoma, which is bone cancer. And bone cancer is generally fairly aggressive. This is very early in this particular phase, and it likes to go to the lungs. And so we took a radiograph of the dog's chest, and it was perfectly clear. So now this leg is basically just painful baggage. And so I talked to the owner. I said, what would you like me to do? And he said, well, what can we do? Can we do something for the dog? And I said, yeah. I said, it's ridiculous to keep this leg, really should be amputated. And he said, okay. So we went ahead and amputated that hind leg. There we are in recovery with the bandage. Hey, you gotta love dogs. I mean, look. I mean, is this a sad face? No, it's not a sad face. I mean, we're on a lot of drugs too, by the way. So, you know, but you know, this dog's my hero. You'll find out why in a minute. So anyway, so we go along. There we are. It's after surgery. Kind of looking at us, kind of wondering, you know, am I getting out of this place now? And yeah, you're getting out of this place, all right. So this is long after, you know, sutures are taken out. Just to give you an idea, it looks kind of normal back there. Went right back to work again. Herding dog. Herding sheep. She was 14.
Wow.
That's pretty amazing. 14 years old and go through that. I'm impressed. She's my hero. She's tough. And she had a great time. She got rid of the painful leg, went out and did her job. Had a wonderful time. This is an interesting piece of surgery here. I'll show you what the dog looks like in a minute. This is a 2-week-old English setter. And his chest is open. And my instruments are basically on top of his heart right now. Okay? And there is a little white thing right there. You can see that underneath this pair of hemostats. That is a ring anomaly. And ring anomalies are little vessels that grow off the aorta and whip around the esophagus where they don't belong. So this puppy came in regurgitating milk, not vomiting, but regurgitating, which means he sucks on it, he swallows it, it gets halfway down the esophagus and falls back out again. So during the examination, we passed a feeding tube awake on him, and sure enough, it stopped halfway down the chest. So we knew what his problem would be, because this is a thing that's inherited. It's very rare, but it does happen. So this was a case we said, well, let's refer this to Angel, and they said, either you fix it or put him to sleep. So obviously, you know, here's the picture. So we got in there, and of course, we had to breathe for him because our anesthesia system is not automatic, and so I needed one of my staff to watch the gauge very carefully, to be very gentle with expanding his lungs, because once the chest is open, he can't breathe, okay? There's no vacuum in there, your lungs can't expand, somebody's got to breathe for you. And she had to be very careful while we did this so I could do the surgery and yet keep his oxygenation up where it belonged, which she did a great job. So we're in there. Another picture of the same thing. You can just kind of see what I'm working on. It's this right here. Okay. So basically, we tied that off and snipped it, and then one of my other staff put a feeding tube and right down the chest and into the stomach. So we're good. So we button him back up again. We close his chest, close the skin, reestablish vacuum in the chest. You don't get all the air out of there. You don't want air in your chest. It's supposed to be a vacuum in there, air in the lungs, but not in the chest. And so there he is after surgery. Okay, you can see his surgery line there. And that's my thumb, so you know he's not a very big puppy. Okay, his name was Plaid, as you might guess. So this surgery happened like just a couple of days before I was supposed to visit my dad out in Canandaigua, New York for his 80th birthday, and so Plaid stayed with me out to New York during the trip, got fed by me. We went to some fancy restaurant for his birthday party, and it said no animals in here. I brought the carrier in, and I told two of them what the story was, and they said, put them wherever you want. So that was pretty nice, you know. Yeah. Having a good time, you know. These are the fun things. So here's one that didn't need surgery. You know, I kind of nicknamed this dog Pebbles. So she had this thing for eating pea stone, just liked to eat it, and it all would come out, you know. Didn't need the Wonder Bread for this, by the way. So it just all came out on its own. And this was just this radiograph wasn't taken for a problem. The owner said, hey, I wonder just how much she's got in her at this point. Just out of idle curiosity, you know. And we looked at it, she goes, boy, that's a lot. And I said, yeah, it is. And she goes, okay, thanks. That was the end of that. So it was kind of fun. It's something that didn't really need any work. Okay, now we're getting to the good stuff. So Sean mentioned that I was involved with internship. This is the students from the Wells School. They are learning 4 suture patterns. They're learning a simple interrupted vertical mattress, horizontal mattress, and forward interlocking continuous. They're learning how to use the instruments properly. They're all sewing up towels that I have put incisions in so that they can close those. They learned how to hold the instruments properly and how to use them, and exactly how to take care of them. They each got a set of instruments that they could take home and practice if they wanted to, and it was good fun. They learned a lot. They also needed to learn surgical anatomy. They needed to know, abdominal anatomy, what's the linea alba, or the white line that we go through to access the abdomen. They needed to know the anatomical names for all the parts that come out during a spay or during a neuter, and they all got this stuff down, and they're good students. They're very good. I did a similar thing, at Conval as well, and then also a couple of veterinary students came through and did internships with us as well. They're working away. Everybody's working on sewing here. A little bit of competition here. This guy was like unbelievable. I mean, most of these guys got like maybe 1 or 2 stitches here, and he was like a human sewing machine. It was phenomenal. It's a pretty amazing guy. Had great hands. It's really remarkable. Yeah, cleanup. So, bunch of sutures, bunch of towels. So this student mentioned to me when we were talking about careers that she would someday like to be a cardiothoracic surgeon. I said, really? That's interesting. So we happened to have this one case where a cat had come in suddenly deceased, and the cat had something called hypertrophic cardiomyopathy. If any of you remember Len Bias, the basketball player who dropped dead, he had hypertrophic cardiomyopathy. So it's something where the heart muscle grows bigger, but the heart doesn't grow bigger. So it grows inward, the chambers get smaller, and at one point in time, either there's an electrical mishap or there's a massive stroke because of the increased velocity of the blood, and there's sudden death. It's very common. So we did a postmortem on this cat, and the owner gave us permission to do whatever we needed to do with the postmortem. So when we got the heart out and we opened it up to show the thickened chambers, I could see her eyeing the heart, kind of like this, desiring that heart, I think. So I said, well, you want to sew that heart back up again, don't you? And she goes, oh, and her eyes lit. I said, okay, tomorrow. So here we are. We said, fine, we're going to do it right. You're going to wear a gown, you're going to put gloves on, we'll throw a drape over the heart, and we're going to let you sew it back up again. Okay? It's a big, good experience. Okay? So there she is. She's holding the instruments absolutely correctly. This is exactly how you hold them. She had to have practiced. She only had a couple days before this, but it was remarkable to watch. I mean, it was mind-boggling. She was doing better technique than some of the veterinary students that I've had in doing internships with us. And so there's the suture line, and I mean, it doesn't get put together any better than that. So I was really impressed. I was glad to have her have a chance. Her partner, who also came with her at this time and was studying, told me he wanted to see brain surgery, and I said, that isn't going to happen. But lo and behold, and I didn't bring photos of this, but lo and behold, not long after, we had a dog that was having increasingly bad seizures at an elderly age, and we could tell from the clinical signs that this dog did have an intracranial mass someplace. He and I did the postmortem together. He and I did remove the brain. He did get a chance to see the cancer in the brain. So these two, I don't know how they lucked out, but somehow the things that they wanted to get exposed to really worked out. That's the great fun of being a mentor. So this young lady is also from the Wells School, and she wanted to know how to give an injection. This dog is fully anesthetized. This dog isn't going to know anything that happens, right? But there's this preconceived feeling about injections. It's our feeling about needles and all that kind of stuff. Well, she had a lot of empathy. This dog's anesthetized, It's just amazing. Anyways, I don't think she went on to do anything with veterinary medicine. But it was a good experience just the same. Okay, so before I get to the next picture, so it's me with a young Labrador puppy who is very frisky, and we're having a lot of fun, and he's jumping around, and he's on the table, and he goes to jump off the table, and I catch him, okay? And I just happen to catch him, and he's kind of upside down. Now, any of you know what anal glands are in dogs? Those stinky things that skunk spray? It's underneath the tail of the dog. So this picture kind of came out, and just for fun, I dubbed it, now this is the Three Stooges method for checking anal glands. Okay, the pun's intended, that's the end.
Thank you so much.
I guess I left enough time for questions.
That's
didn't I?
great. That's great. Yeah.
Good.
So we can take a couple questions. I'll try to repeat the questions after people ask them. So who would like to ask a question? Please raise your hand. Go right ahead.
Well, it's interesting that you brought this up at the very end, because we have a nice young male cat who has that problem. And we're wondering, we don't give him much of the canned food, so he has more solids. But we're wondering, is there anything else we can do?
So the question is wondering about canned versus solid food in terms of anal glands. Is that what we're talking about? Right.
They used to call them anal sacs, but we don't call them that anymore. That's, pronunciation can be difficult. So anyways, so as far as the canned versus dry food, I don't think it makes any difference. The thing is, it's basically those glands are oil glands, and so it might be an omega-3 supplement to the dry food, and there's loads of them available. I would do that rather than switch to canned food. I'm nix on canned food for cats. All the cats that we see that need extensive dental work are all on canned food only. The ones that are mostly on dry food really do quite well. They don't need so much help dental-wise, and nobody brushes their cat's teeth. Well, not many people. So little omega-3, omega-6, supplement to the dry food. Comes in pump forms, comes in a bunch of different forms. It might come in little capsules where you can prick it with a needle and squeeze it on. It's going to be fish, based, so it should go okay. That would help get this stuff so that it's not so viscous. Yeah. Sure.
Next question. Go right ahead.
So the dog with the pea gravel, a lot of times with humans with pica, you have like absorption issues and things like that. The dog that ate all the pea gravel, did they have any kind of dietary, issues afterwards? Did they do well with food absorption? Were they like just constantly eating that much? Really interested in me if they didn't have other. I'm just curious.
No, that's a great question. So he's wondering if there was some other condition on why this dog was eating all those pebbles, or did they cause trouble later on? Actually, that's a very good question. So the dog is eating those stones, in my opinion, because the dog does have chronic IBD, inflammatory bowel disease, and was on a special diet. But even so, there's a tendency to eat stones or lick metal, like the refrigerator, or lick the floor, or do something like that when there's low-grade either gastroenteritis of some kind or intestinal. And interestingly enough, this dog was in perfectly great shape. Really didn't have trouble with diarrhea like they might have with IBD, but just chronic IBD. It was a little difficult to manage it. The dog did go on at one point in time to develop some pancreatitis, and with that inflammation, I did go in and had to do a bowel resection on the dog where some of the bowels had been damaged, recovered from that okay, but there really was underlying bowel issues. So it was a great question. There's a reason for that. So, but dog lived a normal lifespan though. So. Yeah.
Go right ahead.
How long did the sarcoma dog live after you amputated the leg?
2 years. Yep, we lucked out, and we did not go through chemotherapy on that dog. We used an anti-inflammatory that has what they call some angiogenic effects, which means it tends to block the formation of new blood vessels that feed cancers. And there's some, you know, holistic stuff we did too, that they would like to do, that's a little bit anti-cancer as well, but did not want to go the routine chemotherapy route, which was fine, you know, it's fine.
Go right ahead.
We had a corgi, and about age male corgi. This is 10 or 15 years ago, or 20. And about age 5, he started having seizures. And we went through every procedure from Angel to Tufts, Peterborough. Dr. Fritz was our doctor at the time. And we never could get ahead of the seizures. We finally had to put the dog down. Is there any progress on seizures in dogs now? Would he be better off today than he would have 20 years ago?
He might be. I wouldn't say yes for sure, but he might be. I think we have more anti-seizure medications available now. There are dogs that are on multiple seizure medications to control it. I know of one farm dog that I treated, ended up on 3 medications, and that was the only way we can control the seizures, and that dog actually still worked, did fine. But it's difficult. It's a very difficult thing to control well. Seizures starting at that age, you know, most assuredly it's epilepsy. You know, that would be the diagnosis. And but it just takes a lot of work of manipulating the drug dosages and how many drugs you actually end up using. So it's not uncommon to use more than 2. Yeah.
Thank you.
Sure.
Question, Joe.
There is now something called animal rights law. You might guess I would bring this up. And it's taught, and lawyers practice in the field. Have you had any encounters with that relatively new phenomenon, and does it affect your practice?
That's a great question. So Joe asked about animal rights law, and I have not personally had our practice involved with that. We've had some situations where we needed to report a behavior, and that ended up having something to do with animal rights law. My best exposure is one of my clients' daughter is a lawyer out west in Seattle, and this is what she practices. That's it. That's what she's doing. And I find it really interesting. I think I think the animals deserve to have a voice, you know, legally. Certainly in some of these cases when they've been really badly handled. So the question is how do we get started with it? And it probably comes from us or somebody who sees something and needs to work something out. Then I think there's going to be possession, you know, as far as when there's families break up and things, and who gets to take, control.
We have time for 2 more questions. Go right ahead.
So about the Wonder Bread, if you suspect that your dog was swallowed like a little pin or a needle or something, how much time do you have to get that Wonder Bread in their system before it's a problem?
Okay.
And you should go to the vet.
Okay. You should go to the vets anyways. That's the universal answer, right? No, it's a good idea though, because what you don't want to happen is you do not want that to be vomited. That's bad. That you don't want them to vomit something that's sharp. So the time, food normally stays in the stomach for about 3 to 5 hours, and then it's emptying, okay? So if it's still in the stomach, you're fine. It doesn't matter if it's left the stomach. Even if it's left the stomach and it's in the small intestine and it's 6 hours later, still give the Wonder Bread. It might keep it from getting snagged someplace as it's making its way through the whole intestinal tract. And we had one dog we did this. It was great. Of course, it would be a Gordon setter. They're an amazing breed, but he had swallowed a carpet needle, and they did the Wonder Bread, and it made it all the way through, except at the very end it got stuck, but you could actually see it. Yeah, he was a pretty funny dog. Actually, Melissa, I think, even knows that case, actually. I think she remembers that. I think there's one on the
Last question? No?
Is there like 2 questions, but they're connected, so we'll follow?
Sure, yeah. We have time.
So, 2 things. You probably helped tens of thousands of dogs and cats, right? But also you probably had to be there at the end with tens of thousands of dogs and cats. I wonder
how have you dealt with that? Did it ever get easier? Second part of that question, we live on Concord Street, a busy road. So there are people on our street who let their cats out at night. And the other day, one got hit. So if somebody brings an animal to you like that, and you have to try to help that animal, but you know it's because the animal doesn't know about across the street. Is it your place, do you feel, to talk to that owner? That's my one question.
Well, of course, absolutely. You know, if we get in touch with them and let them know, you know, that they should, you know, try to keep them indoors as much as possible. As far as the end of life situations, I have a limit. There's days where things just seem to pile up, and I can be in one room and we're letting one go that's not at an age where I think we should be letting go, but we have to because of various reasons, like the disease is so bad it's time to go. And maybe I'll have to do something else and then go next door and take care of a puppy that just came in, you know, it's brand new, and then go back again in another. And I've told our receptionist, look, 3 is it. You can't give me more than 3 in one day. You've got to give it to somebody else, because then I just literally can't handle it. And it does not get easier. You know, I spend a lot of time late at night not sleeping because a lot of these things do haunt me, and I think about them. And I, you know, the scientific part of me says, you know, make a good judgment. The humanist part of me means support the clients, make sure they feel like they're doing the right thing, be behind them 100%, and make sure the animal gets a fair shake out of this whole thing, that they don't linger longer than they should. And those are some pretty whopping stresses. So yeah, not any easier. No.
What a beautiful way to end the wonderful talk. Thank you so much. Really great. Please join us at the reception following the talk. And join us on February 7th, next month, when our speaker will be Mr. Paul Tuller. He'll be talking about building his Japanese house. He's a master of hand tools. And if you're interested, you can check out his website, paultuller.com. It is fascinating. It's filled with wonderful videos. And like with this, sign up early because these talks are filling up quickly. I'd like to turn the floor over briefly to the president of the Jaffrey Civic Center, David Beltate.
Hello, everyone. Thank you so much for coming tonight. Sean stole a little of my thunder.
Oh, sorry.
Please consider coming next month for Paul Tuller's speech. And I would like to give Chuck.
Thank you very much,
Our
David.
speakers are not remunerated in any fashion, so all we do is some small gifts. And it's a token of our appreciation for coming and speaking here, and it was wonderful.
Thanks, David.
Thank you.
Feel around a little bit and have a glass of wine and a little bit of refreshment. Thank you.
All right.